Welcome to Kids Considered, where two pediatricians discuss children's health topics of interest to parents in a podcast with new subjects considered every episode. I'm Dr. Lena Vanderlist.
And I'm Dr. Dean Blumberg.
And we're both pediatricians at UC Davis Children's Hospital in Sacramento, California.
So in this podcast episode, we're going to spend the whole time reviewing one specific hormone, now commonly given as a synthetic hormonal supplement, and that's melatonin.
And I'm so glad we're doing a deep dive on this today because over the last few years, the use of melatonin has really skyrocketed. So melatonin is the second most popular natural product that parents will give to their kids, only after like a multivitamin. And as a result of increased use and increased advertising, families' questions about this have also totally increased. So I'm having conversations about this definitely weekly, if not more.
So unfortunately, because it's so widely available over the counter in the U.S., as well as being packaged for kids in the forms of gummies that look really attractive to them, there have been several reports of accidental overdoses, and these have increased dramatically with calls into poison control related to melatonin ingestion, increasing 500% over the past 10 years. You may have seen this in the news.
Yeah, it's been a really big topic. Before we get into the specifics, let's back up and just review for our listeners what melatonin is.
Sure. So melatonin is a hormone that is produced by the pineal gland in your brain, and it helps to regulate your body's circadian rhythm or sleep cycle. So this is referred to as its chronobiotic effect. For some, it also has a hypnotic effect and helps you get your body to sleep.
I know it sounds chronobiotic. It kind of sounds like a
robot almost.
A robot.
Yeah, but chrono is that's Greek for time, right?
Yes. Yeah. So like the circadian rhythm effect of it.
Mm-hmm.
So remember that our brains all make melatonin on our own. And usually we naturally start to release melatonin from our pineal gland about 1 to 3 hours before bedtime.
And that actually surprised me, as we'll get into later, because I thought it was like right before.
Right? Like you get this surge and then you get tired. But no, it actually starts, it's a slow process.
Yeah. So before we start talking about the supplement and how and when it may be used, I think it's important for us to reinforce that melatonin use should never take the place of good sleep hygienic practices. So most physicians would recommend really committing to these practices for a few months before considering adding melatonin.
Absolutely. So like we always like to say, pills do not teach skills, and that goes for many different things. And this is one of them. So let's remind our listeners what ideal sleep practices look like for kids and teenagers.
Well, it can be a challenge, but it's really having a consistent, age-appropriate bedtime and wake-up time.
Right. And really important is limiting screen time 2 hours before bedtime. I know that in teenagers who have a lot of homework and other things that this sometimes can't be feasible. So adjusting their devices to limit any of that bright blue light exposure during this time. I recently changed my device settings. There's like one where you can change it to like evening mode and it will automatically kick on at a certain time so that it reduces that light exposure.
So getting light exposure in the morning upon waking and getting some exercise earlier in the day, limiting caffeine in the afternoon, those are also part of good sleep hygiene.
Absolutely. And having your routine and really sticking to it. So for younger kids, I love the bath, brush, book, bed routine. So take a bath. Like we know that having a warm shower, a warm bath, and then letting our body naturally cool helps release some of that melatonin. Brushing our teeth, reading a book, and like quiet, dim light, and then going to bed.
And remember to use your bed only for sleep. And we know that many teens do schoolwork or watch TV in bed. And this can create negative sleep associations, meaning that when they get into bed, they're a little bit anxious because they're thinking about schoolwork or homework or some exciting TV show.
And sometimes, parents really excruciatingly have worked on this like sleep routine or sleep hygiene, and their kid is still struggling with insomnia. In those cases, after you've been working on this for months and you really feel like you're maxed out and maybe your kid is suffering because they're not getting enough sleep at night and you guys are suffering, then a discussion with your child's provider around melatonin is a good idea.
So there are some specific individuals that may have more issues with sleep than others.
Yeah. So, for example, our neurodiverse individuals, so kids with autism or ADHD, children who have vision impairment. So, if they're blind, you can imagine you're not getting that input of like your circadian rhythm, like daytime light, darkness. So, that can be really hard. And then teenagers, which we've talked about this before. I don't know if that podcast has already expired. It's like time is flying, right? Every 3 years, our podcasts just kind of like drop off. So I don't know if that one's available or not, but we did one on teen sleep and school start times. And so teens get something called delayed sleep phase syndrome. Not all teenagers. All teenagers will have a natural shift of their kind of like when they feel ready for bed and their circadian rhythm, but some kids get it really bad, called delayed sleep phase syndrome.
Yeah, so please explain again what that is.
Yeah, so it's fairly common. The natural sleep period is shifted significantly later and starts interfering with their daily commitments, like, going to school by 8 a.m., like what they have to do. So these teens that have this disorder might truly be unable to fall asleep before like 1 or 2 in the morning. And then you can imagine it's going to be quite difficult for them to get up by 6 or 7 to make it to school on time.
Right, because they're still sleepy, right? So we talked about how some degree of a sleep cycle shift is common in teens, but this seems like an extreme version. So it sounds like there may be some conditions where, despite working on sleep hygiene, kids, teens, and parents are left struggling, and they may consider trying something else like melatonin. So they want to talk about its use and safety with their pediatrician.
Right. I mean, and, unfortunately, because we're not having these conversations in the office as much, sometimes they're just going and getting it themselves and kind of trying to troubleshoot without having all the background information. So we're hoping to give some of that today.
Mm-hmm.
Most melatonin supplements are synthetically derived, meaning they're made in a lab. There were previously some formulations that they would actually get from the pineal gland of animals.
Mm-hmm.
I'm sure you, as an infection specialist, can talk about why this is probably not a good idea because of potential contamination.
Yeah, so sometimes if you use the brain of an animal, what if it has like mad cow disease or something like that? That would be terrible to transmit that, right?
Right. Absolutely.
Yeah, so we want to start by saying that the data for melatonin use and safety for children under 2 years of age is really lacking. And so this is also the age when it's critical to start setting these foundational sleep skills and routines, the sleep hygiene issues. So if possible, we would recommend avoiding melatonin in this age group for sure. But as kids get older and we're considering adding melatonin for sleep, it's important for parents and physicians to understand that timing of administration really matters.
Yeah, and this is really fascinating because most parents I know that use it give it kind of right away before their child is going to get in bed.
Like a sleeping pill or something, right?
Yeah, like you take it and you're going to get sleepy.
Uh-huh.
But the actual evidence shows that depending on the purpose you're using it for, you want to give it at slightly different times. So if you're looking for more of that hypnotic or sedating effect, you would give it maybe 30 to 45 minutes before the desired bedtime.
And for teens with delayed sleep phase syndrome, there have been studies that show clear benefit for using melatonin, but you want to give the dose 3 to 4 hours before typical sleep onset, and then gradually adjust this as the sleep cycle is moved earlier. This is tapping into the chronobiotic properties and is usually used at lower doses.
Right, then the sedating effect that might be slightly higher. And this 3 to 4 hours before typical sleep onset. So if the kid's going to sleep at 2, then you might start by giving it at 11, if that makes sense. So it's not the desired bedtime, but like where they're at that point.
Mm-hmm.
And then this would also be true that when you're adjusting to time change for international travel. I mean, sometimes parents are still wanting the sedating effect as well. But if you're thinking about like trying to get them adjusted to the new time change, you would think about that as like, 3 to 4 hours before the new desired bedtime is when you would give it at lower doses.
So does it work? I mean, most studies do show some benefit on sleep onset and duration, but interestingly, the dose doesn't seem to matter much. And that's another surprising fact about melatonin. The initial studies used pretty high doses, but later studies comparing different doses show that even the lowest dose studied was as effective as the highest dose.
I know, it's interesting. But that's because even the smallest doses, so like for us, frequently kids like gummies or whatever are marketed as like either 0.5 milligrams or 1 milligram. So if you start there, this is still significantly higher than the amount that our bodies are going to make naturally.
Many times people think that the more they give, then the more effective it will be, or the sleepier it will make them. But this is actually not the case usually. And as we're learning, too high of doses can be dangerous and associated with side effects.
So every provider may have like a slightly different rule of thumb about how they would dose melatonin for kids. The guidelines that I have used in the past is a maximum dose of 3 milligrams for children weighing less than 40 kilos or like 88 pounds, and 5 milligrams maximum for children above 88 pounds. My usual practice is to start at the lowest possible dose, so like 0.5 or even 0.25 milligrams, and increase by 0.5 in a week if parents are not seeing an effect. But again, counseling families that, more importantly, like small doses can be effective, because with all medicines, we know there's this like placebo effect sometimes. So if parents aren't expecting it to work, then they may not notice like those subtle differences. And then remembering that when melatonin is used for shifting sleep phases, smaller doses are usually pretty effective, so even just 0.5 to 1 milligram. And when they're using them for more sedating properties or hypnotic properties, sometimes we need to go a little bit higher, so like up to 5 milligrams.
So anytime melatonin is used, it should always be accompanied by sleep hygiene practices like we mentioned earlier. And we want to stress that sleep hygiene is normally enough in typically developing children, and we prefer to avoid the use of melatonin if possible in younger kids.
One of the really hard things about melatonin here in the United States is that these products are not approved by the FDA, the Food and Drug Administration. So instead, they're sold over the counter as dietary supplements. And so these products may include things that are not safe necessarily, and because it's not being well regulated. So sometimes they've been found to have things like CBD or other supplements included in them.
And because of this lack of regulation, it is really difficult to know if the dose advertised on the bottle is really the dose that you're getting. One study published in the Journal of the American Medical Association in April last year, 2023, this looked at melatonin gummies available over the counter. And in the products that contained melatonin, the actual quantity of melatonin ranged from 74% to 347% of the labeled quantity. So 22 of the 25 products, so 88% of the products were inaccurately labeled.
Yeah. So, I mean, thinking about that, it makes it nearly impossible for you as a parent or me as a provider to know exactly what we're giving your kid, or even follow those recommendations, right? If I tell you to start with 0.5 milligrams and then what you have really has 2, it's really impossible for us to know exactly what's going on.
And because of the lack of federal regulations, child-resistant packaging for melatonin is not required, and that can also lead to overdoses.
Absolutely. I mean, like most of these are gummies, I'm not going to lie. So like kids like gummies, kids like taking these. I've seen, family friends that are like giving their kid this and they're like excited to take it because it tastes good and it's like a gummy. So of course, if it's kept in an area that they're able to access, we know kids are smart. They're going to pull that down and they're going to eat that whole jar of gummies. And that's why ingestions have really skyrocketed. So calls for pediatric melatonin ingestions to the U.S. Poison Control Center increased over 500% from 2012 to 2021. They were associated with almost 30,000 ED visits and 4,000 hospitalizations and even like close to 300 ICU admissions, and 2 deaths were reported in this study.
So it's a very important takeaway is that this needs to be treated like any other medication. So you may consider buying a child-proof container to keep it in. And even for teens, this should be under the control of the parent to dispense and always kept out of reach.
And it's important to highlight that other countries like countries in Europe, Australia, New Zealand, a prescription is required for melatonin, so they can more closely control the dose and the amount that's given.
One thing that parents can look for when purchasing melatonin is a USP verified mark, and this indicates that the product was produced in a facility following GMP, that's Good Manufacturing Practice standards. These products meet some product quality control measures, including containing the amount of an ingredient on the label without harmful levels of specific contaminants.
Yeah, unfortunately, when looking at the melatonin products that are USP verified right now, they seem to be only higher doses, so like 3 to 5 milligrams, and geared mainly towards adults, so like in pill form, which is really unfortunate for kids.
I guess there's probably a bigger market for adults, so that's why they make that effort, so that's too bad. So we talked about dosing of melatonin, timing, and some of the considerations and issues with ensuring appropriate dosing and ingredients in the over-the-counter formulations. Let's talk a little bit about side effects or what can happen if a child takes too much.
Yeah, so drowsiness and headaches are some of the most common side effects reported. But at higher doses, you can see things like delirium, nausea, vomiting, nighttime awakenings, dizziness, irritability, and bedwetting.
And many people also experience vivid dreams or nightmares while taking melatonin, and this could be scary.
Overall, at low doses, when given appropriately for the shortest amount of time possible, melatonin is generally safe and well tolerated.
But we want to stress the importance of discussing melatonin with your child's physician if you're considering trying it for your child.
Yeah, so we hope today's discussion cleared up some of the misconceptions or, confusing things about melatonin.
And we hope that we didn't put you to sleep.
Was that your joke for the day, or do you have another one?
No.
So let's review some of our main points from our topic today.
So melatonin is a commonly used supplement to help with sleep.
Unfortunately, due to accessibility over the counter, it's likely to bring misuse, and increased rates of overdose have really skyrocketed in the U.S. over the last few years.
Melatonin should only be considered in children with severe sleep issues, and mainly this will be in teens with delayed sleep phase syndrome or children with neurodiversity.
We always want to try improving our sleep hygiene practices before trying melatonin.
We reviewed the uses of melatonin for shifting sleep phases, as well as its sedating properties, and talked about usual doses and administration times to help with these conditions.
We also reviewed some of the side effects of melatonin and the issues that come with it not being regulated by the FDA, leading to inconsistent ingredients and dosing amounts.
And we want to remind listeners that if they are considering trying melatonins for their child, they should consult with their healthcare provider.
We would like to thank Dr. Kiran Nandalike, the Division Chief of Pediatric Pulmonology and Sleep Medicine at UC Davis Children's Hospital, for reviewing today's episode, although Dr. Dean and I take full responsibility for any errors or misinformation.
And that reminds me of a joke.
Let's hear it.
Why did the dad tiptoe past the medicine cabinet?
Why?
Because he didn't want to wake the sleeping pills. Sleeping pills?
Yeah, I get it, but it's not your best.
That wraps up this episode of Kids Considered.
You can find more information on our website, kidsconsidered.ucdavis.edu.
Follow us on Twitter at Kids Considered.
And Instagram at Kids Considered.
If you have feedback on this show or topics you would like us to discuss in the future, we would love to hear from you.
Please call us. Our number is 916-915-3388.
Or email us at kidsconsidered@gmail.com.
Please rate us on iTunes or wherever you subscribe to your podcasts.
Thank you for listening, and we hope you will join us for our next podcast.
Kids Considered is sponsored by UC Davis Children's Hospital.